To properly position the chair, make sure that you sit all the way back on it to distribute the body's weight. Adjust the height of the chair so that your feet can be flat on the floor and that your hips are slightly higher than your knees. Adjust the lumbar height to rest in the lower back. Position the seat tilt lever so that the back of the seat is about 1 inch higher than the front of the seat. This helps keep the natural curvature in the lower back. A saddle chair allows you to be halfway between sitting and standing. The height of the chair is positioned such that the hips are significantly higher than the knees, but that the feet are still on the floor. If there is a back to the saddle chair, position it so that it rests in the lower back for additional support. In this position, breathing from the diaphragm improves, and you can get closer to the patient as the thighs are sloping downward, allowing more access. The stool is moved easily since you are using your stronger thigh muscles instead of calf muscles like in a standard chair. It also allows for a more neutral lumbar curvature, which allows for a more neutral head position. Standing while delivering treatment is occasionally needed during treatment of patients who are compromised and may not be able to lay back in a chair. It is also beneficial to mix up your routine and stand for portions of your treatment delivery. You could consider sitting for treatment of the maxilla and standing for the mandible. Consider periodontal therapy treatment for 45 minutes while standing, then sitting for the next patient. Vary your movements and avoid extreme bending, stretching, and twisting just as you would while seated. To stand, bring the patient chair up to you. Do not lean over your patient. You should deliver treatment in the same clock positions that you would do when sitting. Make sure that you move the patient's chair and head as needed to maintain posture. Make sure at any of these positions that you stabilize your lower back by pulling your stomach muscles in towards the spine.